much, Professor Chen. I hope that you can hear me well. I am now in Geneva. When I came for the first time to the headquarters of GAVI, that I'm now the chair of the board since January, but because of COVID, there has been no work here in the headquarters. And in fact, we are a little bit, there is a delay in this conference. So immediately after I finish my words, I have to leave because I have a meeting here in Geneva with Director General of World Health Organization and also Director General of the World Trade Organization. I'm so sorry, but in fact, I have this constraint of time. So I'll try to expose my ideas, but I cannot, unfortunately, as I would like, participate in a debate because of this agenda reason that I hope you can understand. This discussion is on the lessons to be learned during that pandemic. The sad truth is that there has been no shortage of such lessons. I think this global crisis has been a wake-up call for all of us. But I also think that through the many challenges, there are also reasons for hope. And we have to hope and pray that the world can act on these challenges to ensure that we never again face a pandemic on this devastating scale, or that if it appears, we are ready, what in fact did not happen this time. Even the most powerful and rich countries of the world were not ready for a pandemic for this one, like this one. With COVID-19, right from the beginning, it was clear that we needed vaccines to stop the virus from spreading. And thanks to an unprecedented response from scientific community and vaccine industry, we got the vaccines we needed to fight this virus, and in record time. And not just one. There are now 21 COVID-19 vaccines being rolled out across the world, with 128 more in clinical trial and a further 194 vaccine candidates under preclinical development. But we did not just need vaccines, we also needed vaccinations, and on a scale never before seen. We are talking about several times more vaccine doses required for COVID-19 than those normally produced and distributed globally for a typical year. Yet, even before any vaccines were available, there was a major concern. Unless a global solution was put in place to make equitable access possible, we could see a repeat of what happened during the last pandemic, when a small number of wealthy nations bought up almost the entire global supply of H1N1 swine flu vaccines, leaving little for the rest of the world. That is why COVAX was created by GAVI, World Health Organization, CEPI, and also UNICEF. With the support of 194 governments, this is a mechanism that tries to remove financial barriers to COVID-19 vaccines, pooling global resources to secure billions of doses that people in all corners of the world could access, in particular those in 92 lower income countries that would otherwise struggle to get access. As a global solution, that is the only truly multilateral solution, COVAX. But the journey has been full of challenges, and I'm going to be very honest about this. Along the way, we have faced many obstacles, and the obstacles were from vaccine hoarding by wealthy nations, so accumulating stockpiles, excessive stockpiles of vaccines, export restrictions, some of them are still in place, that have affected the global supply of vaccines, and also the supply of vital components and materials needed to make them, and also to some cases of vaccine manufacturers giving preferential treatment to the higher bidders. And so COVAX was behind in the line because the manufacturers were giving that preferential treatment to those who were paying more. In spite of all of this, COVAX has delivered, these are the last figures, more than 445 million doses to 144 countries and counting. And now it's going very quick now, because there was a moment where we simply were able to find the money, but we had no vaccines because they were not available for delivery at the global scale. Now, the vast majority of these COVAX doses are going to people in 92 lower income countries through the GAVI COVAX Advanced Market Commitment. It's a financial mechanism largely funded by donors. By the end of the year, the management of GAVI tells me that it will be possible around the end of the year, beginning of next year, to have allocated nearly 1.3 billion doses. That will be enough to protect around 40% of adults in almost all developing countries and delivered double what we have today. So this will be because now there is a ramp up in production and also a ramp up in distribution. In effect, and we should think about this, we are witnessing the largest and most complex global distribution of vaccines the world has ever seen. And this also thanks to COVAX. And to get an understanding of what this has involved, consider all the pieces that COVAX needed to put in place to make this happen, because it's different from national level. I was also Prime Minister of my country before being President of the Commission. And when we have a country, of course, it's more simple because we are working in one jurisdiction. But here, we have not only to face the scaled up manufacturing, regulatory frameworks, infrastructure, logistics, personnel, data systems, surveillance systems, as well as the necessary compensation, liability, and indemnification legal safety nets. In some cases, I was personally calling the people from the vaccine industry and the heads of state in Africa because there were delays in these legal issues that were in fact preventing us from going forward at a quicker pace. The reality is that COVAX has shown it can work. It works, in fact, for those already that received vaccines that otherwise they will not have access to because they are not producers and they have not the money to buy them at scale. But in fact, it could do much more if there was good and better cooperation from countries and manufacturers. Few countries have escaped COVID without any broader impacts. But many of the poorest nations have particularly struggled because their health systems were already very weak before the pandemic. As a result, we saw the interruptions and disruptions to a range of essential health services like childhood immunization, and this puts tens of millions of people at further risk, threatening outbreaks of other infectious diseases. However, despite the initial impact, with support from organizations like GAVI, its partners and COVAX, many countries were able to bounce back thanks to incredible commitment and hard work. And as the COVAX rollout ramps up, with emphasis now on increasing coverage and leaving no one behind, many countries are seizing the opportunity to build on this drive to achieve much better results. Nigeria, for example, which is currently contending with a number of different disease outbreaks, including cholera and Lassa fever, is pioneering a highly innovative one-family approach by asking parents to bring their children when they get their COVID-19 vaccinations so they can get their routine vaccinations at the same time. They are able to protect more people, not just from COVID, but other life-threatening diseases too. In contrast, Pakistan is building on its expansive polio and routine immunization infrastructure to help expand the reach of its COVID-19 campaign. And this works both ways. By tapping into its polio data system, its COVID-19 reach is fed back into these programs, helping the battle to eliminate polio. The increased investment in both programs, particularly in the expansion of its cold chain, critical infrastructure used to keep vaccines refrigerated so they remain safe and effective, and the strengthening of its centralized data systems will remain in place post-COVID and serve as a positive legacy. Togo in Africa, which has already been moving towards digitization, has also been investing in technological solutions as part of its COVID-19 response. It has become one of the first countries in Africa to introduce digital vaccine passports. This has not only helped increase turnout at COVID-19 vaccination centers across the country, but is helping to reopen the economy by making travel and trade within the country and across borders easier. In the same vein, it has launched a digital platform aimed at combating vaccine misinformation. In a country where more than 45% of people over the age of 14 are illiterate, fake news and conspiracy theories about the pandemic are also very common. By providing access to reliable, fact-checked information, using video content in a range of local languages, the government is helping to boost vaccination coverage within the country. Such public attitudes towards COVID-19 vaccines are key to ending the pandemic, because until people everywhere are protected, the virus will continue to circulate and will risk new and potentially more dangerous variants emerging. But as we have seen in Kenya, for some people, COVID is shifting attitudes in support of vaccines. In the Rift Valley, it has long been a challenge to reach nomadic populations with routine immunization, not just because of their nomadic lifestyle, but because they often favor more traditional health practices and remedies. But some have experienced such disruption to their normal community life and economic livelihoods because of the coronavirus that elders and cultural leaders are now more willing to embrace modern medicine, with some looking at ways to merge it with traditional customs and encouraging community members to get the COVID-19 vaccine and childhood vaccination. But we are by no means out of the woods yet. And for many countries, considerable challenges remain. And I think the greatest risk today will be complacency, including in the most developed countries. I see sometimes too much complacency. For instance, maintaining the cold chain requirements for vaccines can be difficult enough with routine immunization. But now, with some mRNA vaccines, these matters are still more complicated because they require ultra cold storage. This at temperature of minus 70 degrees Celsius, far below what normal fridges and freezers are capable of. Despite this, with support from GAVI and UNICEF, countries like Uganda and Pakistan have successfully scaled up their ultra cold chain capabilities at a rapid pace to successfully absorb and roll out these mRNA vaccines. Staffing has also been a challenge for countries all across the globe. Orchestrating a sudden nationwide vaccination campaign requires trained staff. Dealing with this kind of surge can be difficult enough in well-resourced, high-income countries, but even more so in many lower-income countries where the proportion of trained healthcare workers is relatively low. So some, like Sierra Leone, have taken to recruiting and training volunteers from medical schools to support their rollout. As already mentioned, vaccine hesitancy and misinformation is also a major challenge, and this has been a source of concern. And in addition to the digital solutions I've touched upon and social media that some countries are using to provide reliable information, some more traditional and less high-tech approaches are also being employed. In Kenya, camel riders are being used to provide COVID-19 vaccine education and awareness in remote regions. And in Congo-Brazzaville, town criers are helping to spread the word and convince people of the benefits of COVID vaccination. So far, I've only talked about the impact and the response of countries, but another significant challenge are tens of millions of people worldwide who live beyond the reach of national healthcare systems. I'm talking about 167 million people who risk being excluded or missed by national campaigns because they are internally displaced, they are refugees, or they are people caught amidst conflict. Whether they are fleeing persecution or the effects of climate shocks, people in humanitarian settings must not be missed out. That's why we created also in COVAX the humanitarian buffer. So there are, and I've said to you, some reasons of encouragement that through this devastating global crisis, some positive lessons to take away can help us as global community to become more resilient to pandemics, so that next time we are able to mount a more rapid and equitable global response next time. But in the meantime, while COVAX has made huge progress, we still have some way to go before we end this current crisis. Equitable global distribution of COVID-19 vaccines remains an ongoing challenge. Disruptions to COVAX supply lines has created delays, such that still only 4.1% of people in low-income countries having received their first COVID shot compared to over 71.7% in high-income countries. This is morally wrong. This is morally unacceptable. This is a cause of concern from an ethical point of view, but it's also short-sighted because it will only serve to prolong the pandemic, which ultimately helps no one. COVAX is working hard to remedy this, ramping up its supply lines to increase coverage and support countries in their vaccination campaigns. As mentioned, we are hoping to have allocated enough doses by the end of the year, beginning of next, to protect 40% of adults in those developing countries. But we could get there quicker with more support from the global community by bringing an end to the stockpiling of vaccines and to the export restrictions. We also need more funding to secure more doses, and for those doses to be donated by wealthy countries to be shared more quickly. We also need country support in calling for manufacturers to be more transparent about their supply lines, so there can be no chance of COVAX being pushed to the back of the line. Ultimately, the biggest lesson the world needs to take home from this crisis is that to stop a virus like this, global equitable access to vaccines needs to be the #1 priority and not an afterthought. Because until everyone is safe, no one is safe. And this is not just a slogan. This is indeed a matter of concern, because this virus is far from being completely defeated. And we have still a lot of things to do in the developed and in the developing world. And there are other issues for the future, like giving to public health the priority public health deserves. I hope that this crisis has shown the leaders of the world, as it was now the case in the G20 in Italy, in Rome, that this has to be thought not as some kind of emergency, but we have to put, when we are speaking about sustainability, we have to put health, public health, as an element of sustainability. As I've been saying now, that is so fashionable to speak when you speak with companies on ESG, environment, sustainability, and governance, we should add an H, health. Health has to have the same level of priority as the other matters if you want to not only leave a better and a nice planet for our future generations, but also if you want to have healthy and decent lives all over the world. I thank you for your kind attention.